Importance of a healthy diet. A healthy diet is an important component of life. Choosing a healthy diet enables a person to live longer and healthier, free from the numerous non-communicable diseases. Healthy diet is the key to healthy growth and development and attaining the maximum potential as an adult. It also minimizes the unnecessary financial burden on the individual and the society, as it avoids the unnecessity of taking lifelong medication and investigations. Healthy nutritional choices play a pivotal role in maintaining the health condition of an individual. These choices impact at different stages of life, starting from the birth to death. Unhealthy eating and lack of physical activity are contributory factors to the global obesity epidemic in the world, as well as in Sri Lankan setting. It is evident that dietary habits inculcated and formulated in childhood is carried forward to adulthood. Therefore, practicing healthy eating habits from childhood is of utmost importance in shaping the health status of the future generation of the country. When life cycle approach is considered as an example, if Sri Lanka is to achieve healthy weight gain for newborn babies of more than 2.5 kilos, it is a necessity to address the issues related to adolescent and young girls' nutrition, even before they conceive or before the marriage. Organogenesis commences during first trimester after conceiving, and if the mother is malnourished at that time or if she has a micronutrient deficiency, it will directly affect the fetal growth and well-being. Even though a baby is born with a good birth weight and is exclusively breastfed for 6 months as recommended, development could be influenced by wrong feeding practices. A close monitoring should be done at the time of complementary feeding. If the quantity and quality of food are not assessed and no proper growth monitoring is done, there is a tendency for the child to develop malnutrition nearing the age of 2 years, and furthermore, it can lead to development of chronic malnutrition. Therefore, if a girl is maintaining a good nutritional status, the next generation born to her could be expected to have a good birth weight. In the same manner, if adolescents are overweight and obese, there is an equal risk to convey it to the next generation. These facts depict the importance of optimizing female nutrition status prior to her marriage and even during her childhood. Similarly, the food habits and levels of physical activity set stage to NCDs during first 1,000 days of life, counted from the estimated date of conceiving, up to 2 years of life after birth. Hence, it is considered as the most important period of a person's life. Therefore, it is very important to focus on the nutrition of the female child. If the fetus is affected due to the less nutrients and the mother is undernourished, it will result in the fetus being put under stressful metabolic conditions during the fetal life, resulting in the higher risk of developing NCDs for this child in later life, especially diabetes and hypertension due to this exposure to metabolic stress. When a child develops under stressful conditions, their cognitive function and learning abilities will be affected in the future, and they are prone to low immunity and infections, resulting in further malnourishment and leading to a vicious cycle. A balanced diet is of utmost importance for the growth of a healthy child. If a child is consuming unhealthy food with more salt, sugar, and fat, and engages in less physical activity and following a sedentary lifestyle, they are prone to become overweight and obese even during childhood. If it is not corrected at the initial stages, its results will emerge during adolescent period and adulthood. An adolescent could become an obese adult with these wrong exposures. With the entrapment in this vicious cycle, an obese child will progress to an adult suffering with NCDs. An unhealthy diet will lead to overweight and obesity, which leads to a high body mass index. In addition, an unhealthy diet will lead to gaining a high BMI, dyslipidemia, and high blood pressure. These are some of the key factors for development of NCDs. Hence, these will lead to development of NCDs such as heart disease, stroke, and diabetes, as well as increased risk of numerous types of cancer. Therefore, to avoid these complications, it is necessary to plan our meals appropriately and limit the intake excessive amounts of sugar, salt, and trans fats. Thank you.